pushing the record button. So yeah, so I just wanted to get some, if we could sort of talk a little bit about the experience, and I'll just mention how hot it is here where I am. I hope it's cooler where you are.
It's not.
It's not. Okay. Maine is
I,
not Maine is not designed for global warming.
no, no, it's
No.
not.
No. So maybe we could start with I could ask you what was your familiarity with Native Americans and Native American culture before we started on this journey?
I had some experience with Cherokee. Um, my mom had a friend growing up who was Cherokee, and she was a healer, and we would go to her house, and she would invite us to different healing ceremonies, and would really just kind of talk with us and let us hang out and see things. But I was really young when that happened, so I didn't really understand it in a whole lot of detail.
Mm-hmm.
And then the rest of my knowledge really just comes from school and kind of what I've gleaned, and then being in residency and working with the Penobscot Nation, and taking care of their patients or Ben's patients in the hospital is the only other exposure that I had.
So maybe we could talk about what did you feel like you gained from the experience of learning about ceremony and then actually going to South Dakota?
I learned a lot of things. I primarily learned that the approach to healing is definitely whole person and more on a spiritual aspect than, let's say, osteopathy, although there are some similarities that I kind of noticed with more of the holistic approach. I learned a lot about how community plays a role in their culture and in their healing rituals in particular. It was very important during this dance for community members to be there and to be supportive. And I never really thought about that aspect of any of the rituals.
Yeah. Can you talk about some interesting people that you treated?
Is that interesting people that I what?
That you treated.
So we treated a chief who was a little skeptic about our presence there in general, and then was really skeptical about what it was that we were doing. But his daughter insisted that he be treated, and he didn't say anything, and he laid down on our table and let us treat him. And so we did, and he got up, and he just looked at us and said, "Thank you," and he went back off to his chair. And then his daughter asked him, "How was it? What did you think?" And his response was, "Well, these ladies they probably didn't realize that they weren't really treating me, but I was giving them a blessing."
Ah, how about that?
Afterwards, this is a gentleman who didn't really say too many words with us, but after we treated him, he sat with us and talked with us for a couple of hours and shared stories and teachings and a lot of things, which is not very common for him, I guess, because everybody remarked on it.
Right.
That was an interesting encounter.
Definitely. I know this guy, and he's not known to talk to anyone for more than 10 minutes. So.
And apparently not for white individuals
Right, right,
who are not
right,
part of the tribe or the community. So
right, right.
probably more interesting and uh, I will say enjoyable
Yeah.
pursuit that we did.
So how was it to be a white person in Indian country?
Um, I always struggle with that because I don't really know how to be, because I'm not, I run the line of wanting to learn and wanting to observe and wanting to gather information, but I don't want it to come across as I'm studying them or I'm putting them under a microscope, because that's just really uncomfortable and that's not really my intention. So I think the best advice that I got was just to be present and to be helpful and just to listen and not say anything, which I'm really good at. So
Great. Yeah.
I'm good at not saying things. Um, so that, from that standpoint, it was a good experience, but it was still harder sometimes to kind of know, should I participate in this? If somebody asks me to participate, is it polite to say yes, or is it more polite to decline? And does that have anything to do with the color of my skin, or just because I'm new to them and they don't know who I am?
Mm. Well,
Checking yourself a little bit as far as what you do, but about halfway through the dance, that was less of a concern.
mhm.
I didn't think much anymore. They just I just helped and I listened, and I think that was the right thing to do.
Right. Well, you clearly impressed the intercessor's wife,
Yes,
which is hard to do because she invited you to come back.
she did.
Yeah, which is like she never does that.
That's what I keep hearing. So I think we did something right.
You did something right. Absolutely. Absolutely. Yeah. So, so is there any way we could have better prepared you for the experience?
The week leading up to this, it was a little scattered, in part because we had other obligations and we kind of got pulled into multiple directions. So I don't know if we could truly focus on what it is that we were trying to learn and that we were trying to kind of prepare for.
Okay.
And I know that's really difficult in the position that we are and all the different hats that we wear and the things that we do. But it almost felt like I was just kind of, all right, and now you're going to go and do this and good luck. And I would have liked to have had a chance to discuss some of the things that we had read or heard, and maybe just heard some more stories. But then again, the flip side to that is we learned so much while we were there and just observing and talking with people and listening. So at the end, I don't know if it would have brought anything different, but it might have prepared a little bit more at the very beginning.
Right. Well, I think we were all at the mercy of scheduling. We certainly had a different plan in mind at the outset, but we were all reassigned multiple times.
Mm-hmm.
So, yeah, hopefully we'll be able to do better in the future with the week before the trip, to do talking and, just preparations and things like that. So was there a low point to the trip?
A low point?
Yes.
There was a lot of rain.
Right.
Things were pretty wet.
Yes.
Um, it didn't last all that long though, so that was a good thing. But I think think if that had continued for a little bit longer, I don't know how that could have affected the mood of everybody at the dance, and if that could have influenced things for my own personal benefit. I wish it wouldn't have rained quite so much while we were driving through the Badlands, so that I could have enjoyed the view just a little bit more.
Right.
But no,
Yeah.
I really a true down part of the trip.
Hmm. How about a high point? What was a high point of the trip?
There were a lot of high points. The little excursion that we did through the Badlands to Pine Ridge Reservation, that was a high point. Being invited to come back by several members at the end, that was a high point. The day of the tree, the day that they got the tree and they put it up in the arbor, I think that was a high point too, from the ceremony standpoint.
Yeah.
It was powerful, and it was a coming together of everybody, and you could really sense that this was a community dance, and it kind of became apparent then. So that was very good to see.
Yeah. It does really come together on that. And I've always been amazed at how it all comes together for Tree Day, and it never seems like it will,
Mm-hmm.
but it always does. Yeah. So if a patient comes to you and asks about Sundance, do you feel like you're better prepared to answer their questions?
Yes, I think I
Right.
can do that.
And I wanted to ask you to tell the story about the guy who wanted to go into the sweat with his renal dialysis catheter.
Erin might be the better one because she was actually the one who encountered him, but Erin came to ask me to help with this gentleman who wanted to go into the sweat, and he was a dialysis patient and he had a port, and he really wanted to go in, but he was worried that the tape of his port was going to come off and that the port was somehow going to come out, or there's going to be affected and he was going to lose his port. But he really wanted to go into the sweat, into the lodge. And so we found some duct tape, and we essentially taped it down his port. We didn't have any Tegaderm, and we figured duct tape would probably stick and stay even if he sweats. And so we taped his port in place, and he went into the lodge, and I'm pretty sure he did well, and everything was fine in the end. We just needed to make sure that when he takes the tape off, that he wasn't going to accidentally pull out his port. That was our biggest concern after we stuck it.
Yeah, and I heard that he was so grateful to you guys. He was so happy.
He was incredibly skeptical of us initially. Not sure if he believed us when we said we were doctors, or if he thought we knew what we were doing, but he led us in the end. So
Right. Well, and you certainly got to encounter the complex mixed feelings people have toward doctors on their reservation.
that was something that I was not anticipating. Very highly revered as healers of any kind, whether they're doctors or medicine men or women or anywhere else on the spectrum. So that was, I want to say, a refreshing change, but in a way it kind of was, because sometimes in the job that we have, we feel that we get taken for granted for what we do. and we're often, it often feels at the beck and call of our patients and their wants, and sometimes that respect, or the respect may not be quite as evident, but that was something that was definitely well preserved on the reservation. So it was I almost didn't know how to handle that.
Mm.
I don't know what to say to people sometimes when they talk about healers in such a high esteem.
Right, right. And I think that the bridge was osteopathy because it brought you into their world so much more than the typical allopathic doctor.
I think that's true because I didn't realize all of the assimilarities and the connections between the osteopathic world and the native cultures, and so that was a little surprising to me, but I think you're right. I think that definitely helped bridge that gap.
Right, right. And so if I told you that Andrew Taylor Still got much of what he promoted and produced from Native Americans, would you believe me?
I do. We're reading that book. Actually, reading one of those books currently, so more about that here shortly.
Very good, very good. Yeah. So Josie and Barbara and I plan to write a paper soon about that whole experience of
That's what she
what
was
we've learned.
saying.
Mm-hmm.
So I'd be curious to see that and to read what they have to say about it. We actually talked about that in didactics last Friday briefly, a little bit about the connection. And so we'll talk about it a little bit more once we actually get through that book. We only just now started.
Well, and I'm hoping you guys will let me demonstrate Cherokee bodywork because I was totally trained in that and do it. And the funny story is that I had no idea what osteopathy was until one day I was doing Cherokee bodywork and an osteopath asked me where I learned osteopathy. And I said, "What's that?" So
now I'm curious as far as what Cherokee bodywork is and how that relates.
yeah, no, it'll be really good to talk about. I think somebody's joining us.
I think so.
Hi, it's just Josie. I just jumped on.
Hi, Josie. Great to
Hello.
have you. Yeah.
Sorry to interrupt.
No, you're not interrupting. It's great to have you, and you can join the conversation. We were just talking about how, and it might have been you. We were talking about how I was demonstrating Cherokee bodywork, and somebody asked me where I learned osteopathy. And I said,
Yeah.
right. And I said, "What's
Right.
that?" Yeah, right.
Yeah.
Yeah.
It's so, it does look a lot like it, doesn't it?
It sure
As
does.
you know, at AT Still, he was paying attention when he was out there on the reservation.
He sure was. He sure was. If nothing else, he was a very astute observer.
He was. He absolutely was.
Yeah.
Watching animals and the way nature works and the way people treated each other, and then he applied it, and look at that.
So I have to tell you my favorite AT Still story. It was the time when the Confederates were chasing him, and there was a log across a river that looked impossible to cross. And it was the only way he could get away from the Confederates. This was during the Civil War. And he knew that his mule could do it. And he did. And when he got home, nobody believed him. And so he took them back to see that log and to see the mule's footprint on the log. That's my favorite A.T. Still story.
That's a great story.
Yeah, yeah. He's a man who trusted his mule. And you have to love a man who trusts his mule.
Yeah, absolutely.
Absolutely.
Probably trust his mule more than a lot of other people.
Right, right. He trusted his mule more than people. So, Josie, since we have you here, so I was hoping you could talk a little bit about you've gone to 2 years of Sundance now, and
Yeah.
and the dance apparently seduced you because you danced this last year.
Yep.
And I was hoping you could talk a little bit about what that was like for you.
Oh. Well, you might have to pull me back when I start talking about it. It's kind of like when you are trying to explain what it was like giving birth to a child, and you just kind of go off in some kind of land. But it was amazing, one of the most empowering and beautiful things. And last year, going as a supporter, I was so happy because I brought my treatment table, and I felt very welcomed by the group, by everybody, and I was so fascinated by everything going on that I wanted to do everything. So I wanted to help in the kitchen and serve the food because I wanted to meet people when they came through the line. And then I wanted to set up my treatment table and offer treatment because that's kind of my gig. And then I wanted to learn how to keep fire, so I was fire keeping. I was just going crazy. I was so exhausted, but it was fantastic. It was a fantastic experience. And the very first time I saw the dancers last year under the arbor, I had this experience where I felt very large, like super, super huge, bigger than any tree. And I was looking down at these people, the dancers, and they would just look so dear. And my heart was going out to them like they were suffering, and I know that they were doing this for the people. And I felt like definitely like a super being or something. But then, kind of in the same sitting, I then felt very small after that, and I felt like this tiny person, this tiny human being, that these beautiful dancers were doing this for me, for us, for the people. So that my perspective was shifting and telescoping in and out. It was very moving, and so I came back after the healing round. On the fourth day, I went to the tree and I cried harder than I think I've ever cried in my life. These tears of just from my toes, from the ground, just through me. And there was a lot going on for my family at that time between both parents, quite sick. So anyway, I felt very moved. And so I knew I'd be back. I knew I'd continue to support. And my intention this year was to basically do the same thing. But these steps that were showing me that I would be dancing, the first was when I went to your revitalization ceremony at your property, and you asked me if I was going to dance, and a piece of me was screaming, yes, I'm going to dance, but the rest of me, the regular part of me was saying, no, I'm not ready. I need to go, have a few years to really understand, and maybe I need to have some kind of vision or something, do I don't know, something that prepares me for it, because it was only 3 weeks away. So that day when I was gifted a chanupa, and that kind of told me, when I had it in my hands, I had a sense like this is bringing me closer to actually dancing. So when I went and I arrived that Saturday afternoon, the dancers were all coming out of their first purification, or I don't know how many purification ceremonies, lodges that they've done. But when I came out, the women were looking at me from across the fire, and they were so welcoming to me. I felt like I was coming home to them, like I haven't seen sisters or something for a long time. So that, I felt very welcomed. Still, I felt like, no, I went to one of the chiefs and I asked if I could work on being a fire keeper. So that's what I took the role of, and, participated by the fire, but then I was having this longing of being more involved, of course. So each night for me, I brought my chanupa into the lodge to bring it through a series of ceremonies so I can finally birth it and start smoking it. As you had instructed and the instructions I was given. So the fourth purification ceremony was with Al, with Red Serpent, who told me to go sit over there. He points to a bunch of trees and said I should go sit there and think about what I'm about to do. And that was to let my chanupa wake up, essentially. So it was thundering and lightning, and I have a pretty serious phobia of thunder and lightning, but I sat there anyway and was thinking, am I going to dance? Not like, what am I going to do with this chanupa once I have it? I mean, that was important because that's a more, I felt like that was a more serious question of how do I walk with this? How do I best work with this being given to me? So that was really honestly was my prime question. But then the second question is, he said, well, is there something else? And I said, yeah, I'm wondering if I should be dancing. And he put his hands on my hips. He said, okay, so there's a bird, and there's a bird in the tree. And he looks down and he sees this big, juicy worm. Do you think that bird asks himself, I wonder if I should have that worm? Like, no. So I knew, okay, I'm going to be dancing. So that is an affirmative. So I did. I told Barbara of my intention, and she told me to prepare to sit with the chief, which I did, and I prepared my chanupa and offered it and asked if I might dance. And but I was grinning. Like a fool, like just a child at Christmas. Like, I just got the best thing. I can't even hold it inside, but I really want to do this. So I felt such joy to be even asking this question. So they said yes, and the women helped me prepare my things. I had probably 24 hours to get my act together for my regalia, and mentally I've been preparing, really. So it was more about the externals of the regalia and, do I have a fan? Do I have this? Do I have that? Which is, I know, not as important as the process of bringing myself into this space. So do you want me to stop talking? I just feel like I cannot stop talking.
It's okay. Fabulous. Keep talking.
All right. So it was time to move all my camping gear. I moved over, and I realized, well, today's the day. It's tree day. Tonight, it was the night we would be sequestered. And these little details that you don't think about, like, there won't be water because you're fasting. And, I can't brush my teeth. No, so you're not brushing your teeth. These, funny details of, being physical just start coming up, what do you do about this? What do you do about that? So, really, I went to bed and was woken by a drum, and it was before sunrise, and that's the start. I mean, I was so excited. I was so cold because the weather had shifted. And the amazing thing on day one for me was to experience the way the sun was changing everything from time to time whenever we stepped in the harbor, from the time we entered at sunrise in the chill, and then the birds started coming, and then the shadows were changing, and then it was more hot, and then the height of the day was so intensely hot, and you just look at this tree, you just praying for praying. It was just all about prayers, and breathing and feeling the grass and feeling the drum and being connected to everybody who's there and the sky feeling which direction was my home. Where is Maine? Oh, it's over in that direction, over towards the northeast. And knowing that I could bring people there, I could bring my mother to this tree. I could bring the president to the tree. People who I never thought I would want to be bringing to the tree, I felt like I had to bring, summons to the space, because this was a place where I could do my best of giving good attention and goodwill to this planet. So day 2 came, and all I could think about was water. Water was the most important thing on my mind. I was not praying. I was thinking water, and I was feeling, so unworthy of being out there in the arbor. Like, how dare I think about myself in water? Like, what is my problem? I'm here doing this thing. I know that I've made this commitment, but the water, the beautiful silver water and its clarity was the most important thing to me. And it still is. Like, that was my message. One of my messages was how important it is to advocate for our water. And by the nighttime, I was probably at my worst. I was making plans of trying to, wonder if I could dress in black and sneak out and stick all those in my mouth. I just wanted to do these things that would definitely have gotten me kicked out. But there was this very insecure, scared part of me. It was like, I'm gonna die if I don't have water. This is awful. And they're gonna catch me, and this is terrible. Stop thinking about it. Now go to sleep now. So I was tossing and turning and having weird back pain I don't normally have. Just being very physical, very human. And talked about it the next day to the leaders, the women leaders. Like, I'm having a really hard day. I'm very not spiritual right now. I'm feeling pretty selfish, and I can't stop thinking about running away. I want to run away through the water. I'm like, no, it's really normal. It's okay. Meanwhile, we're having another lodge. We're sitting in more heat, and I was itching. It's just good stuff that just can get to your physical body. But when I was out in the arbor, it was nothing was bothering me. It was about this air and the birds and the plants and the other dancers and the swimming and the songs. And it was brilliant. I felt I had no hunger whatsoever in those times without food. I just pretended forever. I want to keep dancing. I want to just keep moving like that, because I was so connected, or I felt very alive. Just as you do, ceremony and sacred time is time suspended. So I was definitely definitely would need to do it again. I feel like people told me, after you come out of the arbor, when this is done, you're going to be different. And I had a hard time buying into that. Like, oh, how could I? But I feel like there's something in me that has shifted in a way of having a great drive to be more prayerful, to hold my chanupa with respect, to understand how to use it. At least as a baby would be given, something that you start to explore. But I have it, and I sit with it. But the water is so precious. Really talking about it and from understanding of what it's like to teach for my patients, that I understand some level of suffering. I may not have an every day of my life from birth until now suffering, but I understand what it's intensity. Deeply, even. I know that motion is the most critical thing for your body, motion and water. And I know it from every cell. So anyway, if I start talking about something, I cannot stop. So I'll stop myself here. It was just a very beautiful experience, and the people were amazingly open and welcome. And we just, it was pretty life-altering.
So could we safely say to Nicole that if she comes again, she might be seduced into dancing?
Yeah. I wish
that.
more people could experience it.
Be content in the kitchen. But very happy.
Yeah. You know, what was interesting to me, Josie, is I had the same vision when I was dancing in South Dakota that you had. That this vision of the spirits looking down upon us and thinking we were so cute and so endearing and so stupid.
Um, That's the way it's very, yeah.
Yeah. And I had this vision of them wondering if we would pull it off, if we would survive or not. You know,
Uh,
like we're really screwing up the earth these days, which of course
yeah.
we can feel today in Maine, this being the hottest summer in history. And just wondering if we were going to make it or not. And I had this sense that they were putting bets on us. You know, some of them thought that we would, and some of them thought we wouldn't. And I thought,
Mm-hmm.
and then I had this sense that it doesn't matter because it's infinite and timeless, and there's multiple realities. And if we all die in this one, we survive in another
Yeah.
one, and it just doesn't matter. And then I thought, well, in that case, I'll just enjoy the clouds. Because they're really pretty clouds. I really like those clouds. Yeah. So, so Josie, in terms of the treatment that you did, was there a high point?
In terms of
The
can you ask me
osteopathic.
that again?
Yeah, in terms of the osteopathic treatment that you did, does something stand out as
When
really
I brought
special?
when I brought my tape, like treating people there on the
Yes,
ground.
yes, yes.
Oh, it was so beautiful to be outside for one thing. I I think the thing that one of the things that stood out to me was that people, I don't know, people wanted it, people needed it, people came to ask, if I of course do it. And there was a time when I had to say I can't because that's when I realized I'd be dancing. So there was a time in my happiest state treating people outside. I was listening to the bird family, I don't know, a few 25 yards over, and I kept listening to this one bird. And a frog kept talking all through the day, and, just listening to the animals and just feeling the heat and connecting with the person who was on the table and just feeling the grass, all that beautiful connection. And then needing to also say, no, I can't, there's a time when I cannot do this anymore because I have to I have to save some of my energy for myself. So that was I don't say no easily. It was kind of part of the theme, another theme for me of, sometimes you have to think no because you're doing something else, and it's okay to do something else. But I think that the high point of doing the treatment outside was being contiguous with the ground, with the air, with the sage growing over there, and the blueberries growing over there, and the children running by. Just a person, two people in this space with good intention to have motion happening through our bodies. I think it was the best way to treat. If I could treat outside every day, it would be I could treat many, many people, but 3 times as many as I treat. And I didn't have to document. That was awesome.
Right, right.
That was very freeing.
Yeah.
Yeah.
So was there a low point for you?
Aside from wanting to dress black and go ninja style up to the hose,
Oh,
that was probably. Do you mean like that, or during
yeah.
treatment?
No, anything, any low point.
In treatment.
Yeah.
No, I mean, aside from plotting my escape, which was probably an embarrassing low point, the other was just, realizing that I had to say no. That I could not share the sticks. I had to stop. That was a low point. I felt like a heel, like I know that I've got this. I know that somebody's asking me. They're hurting, and I could help them, but no, I cannot. I have to say no. So that was no, that feels bad, even
Yeah.
though I know.
So,
No.
so just so I can sort of record it, let me ask you, because the goal here of this experience was so that doctors could be more um, savvy when people come to them to talk about Sundance. And do you feel like you have a better sense of how to advise someone who's contemplating Sundance with
Oh yeah.
wonderful?
Yeah. Yeah. So I think. I mean, I have a sense that this is not scientific. It's just from my observation that there's something, and I wouldn't tell this to a patient. I'm going to preface it that there are people who, the helpers, the experienced dancers who are serving as helpers, support, and guides that will make sure, they're keeping an eye out for people for dehydration, for signs of not wellness. But there's the nature of going into a ceremony. There's also something that happens in the body that is, I can't say that there's any scientific proof behind it, but something happens to the body. You can do a lot more than you normally can. However, if you know that you have a heart condition or condition or are susceptible to other things, it's important to be able to share that with the people you're dancing with, because people look out for one another, and it's a pretty demanding. In some ways, it's a very demanding event, but on other ways, again, you're supported by knowledgeable, respectful people who are watching for you. So I'm going to say, bring your medicine, stay well hydrated, eat, rest, pray, make sure that you're mentally prepared for what you're about to enter into. And then something happens, magic happens, and I've seen people who need help get help. So I guess I'd want to know, what have they done to prepare for it?
Yeah.
And I don't think it's like, physically climbing with your backpack on kind of preparation. I mean, in your head prepare.
Yeah, yeah. That reminds me, when during the dance that you were at, and just to clarify, Josie, you were at the Cayuga dance, and Nicole was at the South Dakota dance. But at the Cayuga dance,
Yeah.
there was a guy who told us about all his medications, and we made some adjustments. He had type 2 diabetes. He had a bunch of other things. I can't think of them right now, but so we adjusted his medication. And then at the end of the second day, he said, "Hey, my pee is turning orange and it burns like razor blades every time I pee." And so I came over.
Uh,
Yeah, I came over to him. I said, well, that's kind of worrisome. I said, has this ever happened before? And he said, yeah, it happened last year when I got rhabdomyolysis.
Oh, God. Yeah.
And I said, well, dude, maybe you want to go to the emergency room. That's not good. And he said, really? Really? Do I have to? And I said, yeah, dude, really, you have to. And so,
Yeah, you have to.
yeah. And so he
That's,
did.
yeah, that is, you know, that he had a number of chronic illnesses, and then he got very sunburned.
Yes, he got very sunburned.
On his, you know, he
Yeah.
got very sunburned.
And his CK was 1100. So they gave him fluid overnight, and he came back the next morning to support. And I thought, well, you know, it's really good that we had this trusting relationship, because if we didn't, he could have died. You know. So